5 things you need to do after 40. Yesterday we spoke about 5 things you need to stop. Let's begin. Number 1, check up on your health. Time to watch the blood pressure carefully and get treated with diet and exercise. If it's still under 140 over 90, you need to treat that. You've waited too long. If your doctor tells you it's all good because your blood pressure is 130 over 84. Anything over 120 over 80 is a bit elevated. Any elevation starts to increase the risk of heart disease and stroke. So even if you don't need medications, you should try and lower it with diet and exercise. And always get a blood pressure cuff at home. 1/3 of everyone gets anxious in the doctor's office, and it can be elevated there. We call it white coat hypertension. Number 2, colonoscopy for everyone age 45 or 40 if you have a family history of colon cancer. You want a polyp found, not a cancer. And choose wisely where you're having this. Experienced doctor with good credentials and a clean and professional environment. Remember, bad GI docs can miss a lot of polyps, which means you might come back with a cancer years later. Number 3, a stress test? No, not needed. It just makes money for the doctor and pushes you down a path sometimes of more testing, because when you get a stress test on someone who's not symptomatic, it's very often falsely positive, and then you're getting more tests that you never needed. But a coronary calcium score, now that's reasonable. It's not perfect because it will miss non-calcified plaque, but any elevation in coronary calcium would warrant consideration of further treatment, which includes statins. Number 4, listen carefully. The uphill battle has begun, so start now with a better diet and exercise and follow your weight, and watch out for that type 2 diabetes. Make sure your doctor checks the A1C as well along with your bloods. Now, this is the best chance to make that lifestyle. Now, yesterday I said not to power lift. But weight training in a controlled and comfortable setting is extremely important. Not that one time. Weight training wisely. Sarcopenia is now starting, which is loss of muscle mass. And if it's not checked, it's going to lead to higher risks of falls and, yes, even death. So, one time, this is not good. But a technique with reps and when you're comfortable is a yes. Same thing with running. Too much, not so good. Not so great. Yes, jog, but constant long jarring runs, especially if you're in pain, your knees and hips are in pain, or your feet, it's not good. Your body is telling you something. Mix it up, especially then. Shorter runs, lots of walking, biking, and outdoor sports. And number 5, heart bloods. By 40, you just gotta know. You have to check this. Very simple. LDL, which is the low-density lipoprotein, that bad cholesterol. LP(a), which is that atherogenic particle you check once in life. And high-sensitivity CRP. That's it. The other stuff, like the homocysteine levels, they're not needed. And those fancy fractions are usually not helpful, except maybe the ApoB if the LDL cholesterol is borderline elevated. And remember, you're going to use this with the coronary calcium to help make an educated decision. I hope that helps.